Welcome to New Hampshire's Business. I am Fred Coker. Political decisions are being made in New Hampshire about our health care. And the question is, are those decisions making it better or worse? And some businesses are now weighing in. Here's a quote from one of my guests. Whether you find politics interesting or not, they likely impact your life in ways you may not realize, including the health of our families and communities. Political detriments of health include governmental systems, structures, and policies that impact health. And here are some of the health-related issues that will be up for discussion and debated at December 8th symposium: Medicaid expansion reauthorization, infectious disease response, maternal health care, gun safety, and access to reproductive health care. And some of these issues are also priorities for the Business Industry Association of New Hampshire, and you can see what they are, including Medicaid funding and reauthorization. With me to talk political decisions about health care are Courtney Tanner, Director of Government Relations at Dartmouth Health. Thank you for being here. And David Jouvet, Senior Vice President at the Business and Industry Association of New Hampshire. Welcome.
Thanks, Fred.
I have in my hand a list of 26 bills, health bills, that were in the legislature last session. Your symposium is going to be looking with more scrutiny at some of these bills, perhaps coming up in the next session. What is driving that scrutiny, Dave?
Well, from the business community's point of view, what is driving it more than ever is our workforce shortage. It's being felt by employers throughout the state. And so an important component of that is making sure that we have a healthy workforce. And an important component of that is making sure that there's legislation that is passed that will lead to a healthier workforce. A second component is cost. If the state doesn't properly reimburse for Medicaid or does not reauthorize expanded Medicaid, costs associated with that often get passed on to employers and often employees.
Courtney, same question, but you're from a major health provider in this state.
Yeah, and the largest private employer in the state. So to echo much of what Dave said, but I would also add on that we have 13,000 employees that provide care and treatment for New Hampshire and for our Vermont residents. And our patients care about policies that impact them too.
Right.
And so we need to make sure we have healthy, safe, vibrant communities.
What are some examples of healthcare legislation, perhaps from the last session, that make the point we're making here, Dave?
Well, I can give you an example of several. Last session, there were numerous bills, more than a dozen, that would have impacted employers, prohibiting them from requiring vaccines as a condition of employment.
Right.
Those were all defeated, but had they passed, it would have limited an employer's ability to provide a safe and healthy workplace.
Yeah, and Courtney?
And in that same vein, we saw a number of legislative pieces that were targeting our public health infrastructure. And so we need to make sure that we have a public health infrastructure that is ready to respond to infectious disease and other health incidences that impact our communities. We're seeing most recently an increase in RSV. As you know, all of our children in New Hampshire are susceptible to that. So we need to be able to be ready to respond to that.
Now this symposium, and you're organizing this for December 8th at St. Anselm College. We have a graphic we'll put up that shows some of the details. But what are you going to try to do at this symposium? What's the purpose?
Yeah, so we're going to be the symposium is open to any and all who are interested in learning about New Hampshire policy, whether that's legislative policy, administrative, executive policy. We're going to be talking about the hot button issues that you highlighted, and really how those policies impact our abilities to have healthy communities, ensuring that we have maternity care across the state for all growing families, ensuring that we have safe communities, and talking about things like gun safety, really thinking about how can we ensure that we have healthy, strong communities.
Yeah, and you're going to be on the panel, Dave. And what do you want to get out of this?
Well, I think there's a number of issues that the BIA is focused on. The one that I'm personally going to be involved with deals with Medicaid expansion, which is extremely important. If it's not reauthorized next year, New Hampshire loses $500 million in federal funding, which will have negative impacts on our economy.
Good point. Dave Jouvet, Senior Vice President at the Business and Industry Association of New Hampshire. Thank you. And Courtney Tanner, Director of Government Relations at Dartmouth Health. Thank you.
Thank you, Fred.
And if you missed part of this interview, you can go to WMUR.com, where it will be posted later today and all this week.